What brings you to see us today?
My right shoulder has been hurting me for a couple of months, especially when I hit a serve. And I've tried anti-inflammatories and ice, but they didn't help. And I was trying to train for a national tournament, so I couldn't take any breaks from practice. I played in the tournament despite the pain, but in the final, I was hitting a serve and I heard something pop in my shoulder. I had a lot of pain after that, and I couldn't continue. I had to default.
And how's it been since then?
I still have a lot of pain and it's keeping me awake at night. I haven't been able to hit a serve because my shoulder's weak and I have trouble raising my arm.
Okay, let's take a look at it.
Okay.
Okay, so the first thing we're going to do is just inspect the muscles of the shoulder. We're going to inspect the deltoid muscle on the outside, and we don't see any evidence of any atrophy of the muscles. And your triceps and your biceps all look fine.
Okay.
Okay. Now we're going to check for palpation to see if you have any tenderness anywhere in the shoulder. We're going to palpate along your collarbone, your clavicle.
Mm-hmm.
Do you have any pain there?
No.
We're going to palpate where the clavicle meets your acromion at your AC joint. Do you have any pain there?
No, feels fine.
And no pain back here along the acromion?
No.
Okay. Let's check your range of motion. That's important for us to assess your function. Okay?
Okay.
I'm going to have you put your arms out in front of you
Okay.
and lift your hands up over your head as high as you can.
Okay.
Okay. And bring that left one up as high as you can. Okay, is that as high as you can lift the right one?
Yeah.
Okay, if I help you a little bit, can you get it up a little further? Is that painful for you?
It hurts a little bit, yes.
Okay, lower that down. So we call that an active-passive mismatch.
Okay.
And what that means is that actively, you can only bring your arm to a certain point, but passively, I can bring it up higher.
Okay.
Okay? We're going to check the range of motion and external rotation. This checks the area in the front of the shoulder to see how flexible that is, and if you've lost any motion. And that looks normal.
Okay.
Can you hold it there?
Yeah.
No pain doing that.
No.
Okay. Now we're going to check internal rotation.
Okay.
Okay? And that we're going to rotate your arm down. Any pain doing that?
No.
Okay. So that looks also normal.
Okay.
Now we're going to check your strength. Okay? So the first thing we're going to do is check the strength of the posterior rotator cuff muscles.
Okay.
That's the teres minor and the infraspinatus. Okay?
And those are my shoulder muscles?
Those are the deep muscles of your shoulder underneath your deltoid.
Okay.
They're the important stabilizing muscles of the shoulder. Okay?
All right.
So make a fist here for me, and don't let me push your hand towards your stomach. This tests the strength of those.
Ow, that kind of hurts.
Okay. You have some strength there, but it's a little painful. So now we're going to do a test of your supraspinatus tendon called an empty can test. Okay, I'm going to bring your arm up to the side, and we're going to keep your thumb pointing down like this. I want you to hold your hand there, and don't let me push your arm down.
Okay.
Okay?
Ow, ow, that hurts.
So that's a sign that the supraspinatus tendon may have an injury. Let me have you put your hand on your stomach. Okay? This is a test for the subscapularis, the rotator cuff muscle in the front of the shoulder. Okay?
And what does that do?
That's one of the 4 rotator cuff muscles, and that's the biggest rotator cuff muscle.
Okay.
And that helps internally rotate your arm and keep it on your stomach.
All right.
Don't let me pull that off. How does that feel?
Feels fine.
Feels normal. No pain with that. You have good strength there.
Okay.
Okay. I'm going to do one other test. We're going to take a feel where the rotator cuff muscles insert. Okay? And this is at the insertion site of the supraspinatus. Is that painful for you?
Yeah.
Okay.
Wait, what does that mean?
Well, that's a site where the tendon of the supraspinatus attaches to the humerus. And sometimes if there's an injury there, patients may have pain when you touch right at that area.
Okay, so that's why I can't hit a serve.
That may be why you can't hit a serve.
Okay.
Okay? We're also going to test for some of the stabilizers in the shoulder. There's the labrum, which is like a gasket that lives between the ball and socket. Okay? And a lot of overhead athletes, like pitchers or tennis players, can get a tear of that. So we're going to do some tests to see if you have a tear of the labrum. Okay? And the labrum is important because it adds stability to the shoulder as well. Okay? So the first test we're going to do is called an active compression test. I'm going to have you bring your arm in front of you and hold it there. Hold your thumb pointing down to the ground. Don't let me push this down to the ground. Does that hurt you?
No.
Okay. Put your thumb up to the ceiling. Don't let me push it down now. So that's normal. It's a normal active compression test. That's not a sign for a labral tear.
Okay,
We're
good.
gonna, we're going to do one more test of the labrum called an anterior labral shear test.
Okay.
So I'm going to bring your arm up like this, and I'm going to bring it down that way. Is that painful for you?
No,
No pain at all.
no.
Okay. So that likely means that the labrum doesn't have a tear.
Okay.
Okay. We're going to test here also. You have normal sensation down here in your hand?
Yeah, I can feel that.
Okay. And you have a normal pulse. So, in summary, what we found on your exam is that you had an active passive mismatch, which means you had more passive motion than active motion. And you also had weakness in the supraspinatus muscle and tenderness at the insertion of the supraspinatus
Yeah.
muscle.
Okay.
All the other tests were normal.
Will you be able to fix it?
Well, let's find out.
Okay.